The next lift that we're going to demonstrate is using a mechanical sit-stand lift. What we're going to do first is assist the patient to get from supine to side lying, letting her bend her knees and use the side rail to assist, and then coming to sitting. This is a good point to make sure that the patient can tolerate upright sitting and has good balance, which are prerequisites to being able to use the sit-stand lift. They must also be able to bear weight in their legs and be able to follow instructions. So once we're in sitting, we want to try to get the bed and the patient in position so that she can keep her feet on the floor for stability. We'll then move the side rail out of the way. Once we're in sitting, we're going to introduce the gait or the sling belt for the sit-stand lift. This belt goes around the patient's waist with the inner belt towards the patient. The handles on the back of the belt are away from the patient. This goes around the waist and the inner buckle is fastened. It is important that this step is done because that is what holds the sling belt to the lift and the patient, securing them in the lifting device. The belt is made snug at this point, but not so tight that it's uncomfortable. If the patient is able to tolerate sitting and follow instructions, she can be left there on the side of the bed as we bring the lift into position. If there is a safety issue, a second caregiver would be required to bring the lift in. The sit-stand lift is again weight rated. It is important to make sure that the weight capacity of the lift matches the needs of the patient. We bring the lift into position and assist or instruct the patient to put their feet on the foot plate. The whole foot needs to be on the pad. With large patients, they may not fit within the confines of the yoke, which is okay because we actually instruct the patient to lean back away from that. There is also a calf strap on the bottom of the shin pad that can be used to anchor the patient's legs in position. It is a simple Velcro strap. This is helpful for patients who may lift a foot or are not stable in their standing. We're then going to connect the sling underneath the patient's arms. Their arms must go on the outside of the sling and on the outside of the lift, and we are going to have them position their hands on the handles. The loops are then attached onto the hooks securely on both sides, making sure that they are on all the way. The patient is then instructed to lean back into the belt as we slowly raise her up. Again, the wheels on the lift are in an unlocked position. As we come up, it's a good idea to visually inspect to make sure the loops are still firmly on, and we begin to gently tighten and snug up the belt. Again, the patient is leaning back into the belt, and we're only raising her up as high as we need to clear the surface. As she comes up, she may elect to stand fully. That's fine, by pulling on the armrest if she desires. If she's unable to do that, she can just lean back into the belt and passively stay in the belt. So as she's leaning back now, we're going to back the lift up. Again, the higher we raise the lift, the more the belt will cut into the armpits, so you do not want to raise higher than you need to. We then position over the receiving surface, in this case the wheelchair, which we have positioned as close as possible. These devices are transfer devices, not transport. They should not go more than 10 or 12 feet. We get the position correct, and we then lower the patient down. Again, you'll see the lift gently swing. We may also need to loosen the lap belt as we come down so as not to over-constrict the patient's abdomen. We lower her down over the surface. The handles on the back of the belt can be used if we need assistance in getting the patient to lower safely into the chair in an upright seated position. The sling belt is then disconnected from the lift. We instruct the patient to raise their feet, or we may need to assist them to get their feet off of the foot plate, and then we can back the lift out of position.